So a lot of the patients and athletes that I see have some type of low back pain going on. It's a pretty common ailment. 80% they say statistics are going to have it at some point in their life, and if you have it once, chances are you'll have a reoccurring episode. The majority of what I see with low back pain is a flexion intolerance. So anything where there's a lot of bending forward kind of wears the back down, and we'll get some achiness at some point, some sharp pain, and if we're really unlucky, some type of bulge or herniation to the disc. So what I like to try to do is teach the patient, teach the athlete to bend from the hips, use your hips, get them engaged and spare that low back. Don't bend into a lumbar flexion. So one of the primary exercises I use and teach and give is called a good morning, where it really kind of stresses getting the glutes and hamstrings involved, bending from the hips, not the waist, and those are some of the variations we're going to go over today. The first progression I'd like to teach for the good morning is just to do a 3-minute isometric. Teaches them how to get into the position, engage the glutes, engage the hamstrings, engage that upper back. So what I like to do is your feet are going to be a little bit wider than your hips, kind of slight bend in the knees. Our shoulders are going to be really focused on pulling them down and back. We're going to pack that chin to get a good neutral spine. And as you progress into it, your basically only cue is push the hips back. When your hips stop moving, we stop moving. So good position, shoulders down, pack the chin, push those hips back, and this is the position you're going to hold for 3 minutes. Engage the hamstrings, engage the glutes, kind of feel those muscles kind of working. And that's our first progression. Now for most people, this next one is going to be all they really need to kind of do on their own. It's just we're going to be going in from a concentric, just doing repetitions with the good morning. Again, we're same position as before, and all you're kind of thinking about doing is kind of pushing back, coming forward, squeezing those glutes, staying in a good position, never losing that arch in the low back. Shoulder blades are always staying down and tight. And as we come up, we squeeze those glutes to kind of keep them active. So that's the second progression. So the last progression is actually we're going to get out a barbell, put it on our backs, put some weight on it, and start to actually physically try to get stronger. You know, this is going to help with your deadlift, it will help with your squat, but when you do it correctly, it's going to help with that, keeping that low back pain away. It's going to teach those muscles that when you're bending, picking something forward, doing something in front of you, whether you're washing dishes or picking up your kid or something, it's going to keep that achiness low back from coming back. So this would be the last progression in terms of just getting things stronger. So I always keep those in the 6 to 8 range. It seems to be pretty good. I don't usually have the max effort type work. Try to do 3 to 5 sets like that, and then we're going to go over now some of the things that I like to do in terms of stretching in between those sets. The target here is the right hip flex, the right psoas, a little bit of the iliacus, sometimes a little bit of the rectus here. Again, this is for keeping those muscles around your pelvis nice and loose. This will tend to get short with a lot of sitting, a lot of biking. So I like to pair a few of these things with the good morning. Anything picking up out of floor if you're doing some deadlifts, or you're sitting at a desk, or you're getting out of your car after a long trip. So what we're going to do is tall chest, kind of push that pelvis forward, drive that knee into the floor so we get kind of an angle going through here. Kind of reach up like you're touching the ceiling, and you're just going to bring that across. Now this is a stretch that I kind of like to hold for a duration. Some stretches are more of kind of a pulse, but I think this works best with a durational type stretch. So that is for your hip flex. So this last stretch I like to pair is kind of fairly new to me. It's again coming from a physiotherapist out in South Africa that has noticed that when she loosens up the pec muscles, these big internal rotators, for some reason it turns the hamstrings and a little bit of the glute back on, mostly hamstring, which I found pretty interesting, so I tried it myself, and it really does work. So lately, with some of my hamstring exercises, like the good morning, anything to do with low back pain, what I like to do is really just start to pair some of the more active work with the good morning with some passive stretching for this pec, for that internal rotation. So I like to go in front and get that shoulder a little lower than my hand, and kind of just turn away from it, and kind of do some pulses in here. You're going to just kind of find a few different areas. The pec's made up of 3 different heads, so we want to kind of go lower, mid, and high. And you're just going to kind of work this for 30 seconds to a minute, just to work on getting that pec fascia, pec muscle to kind of really loosen up. And what you'll notice is if you kind of continue with this, your hamstrings will feel stronger on your upcoming set. So that's the progression I like to use in teaching the good morning, getting the hip flexor stretch, getting that pec stretch involved with it, kind of on those rest periods. But again, this is after I've already cleared out any type of hip imbalance, any type of pelvic rotation, any hypertonicity in the multifidi, the erectors. So this is kind of going from out of pain to how can we prevent it from happening again. So don't just jump in and start doing good mornings and think that all your back pain is going to go away. First get everything cleared out and then start to cement in good movement with this type of exercise.